Welcome and thank you for joining us on this new episode of Mofeed-19. I am Hesham Sallam. I am joined by my co-host Amr Hamzawy. This is the second of two episodes discussing the Social Protection Egypt project at the American University in Cairo. Our guests are once again project investigators Amr Adly and Dina Makram-Ebeid. Welcome back to our conversation.
Okay. I would like now to turn to the topic of healthcare. The project released a paper co-authored by Ala Ghanem and Ayman al-Saba on healthcare coverage in Egypt in pandemic times. How does a project assess the Egyptian government's healthcare response to the pandemic?
I think to just say a general thing, one of the main things that the paper on healthcare looked at was how, again, the reach would have been way, way bigger if we had what the paper calls like a whole society approach in a way, which is basically the decentralization of the healthcare interventions that we had. And the paper argues that we do have a good infrastructure for that. It just wasn't really materialized enough. So it became really centralized in the access to the healthcare and the access to information, the preventive, because we weren't just interested in the kind of what was there, what were the interventions that happened, but the preventive healthcare was quite limited, again, by the idea that everything was centralized. And so one of the main recommendations was, specifically as we're thinking of, that paper on healthcare is a really important one because it also assesses our intervention and what it means in the future as we implement the universal healthcare law, right? So the idea was, okay, there's something massive happening in the healthcare system. There will be universal healthcare coverage and or national healthcare coverage, and you call it universal healthcare coverage of everyone being able to access healthcare. But what are the infrastructures that we're using? And I think one of the main things was it just can't be done in that very centralized way because you just don't end up using the resources that exist. To add that when we talk about whole society approach or the idea of like decentralization, the idea was that we have healthcare units or, that should have been used much more instead of hospitals becoming the main center of focus. And then lots of doctors falling ill and passing away, unfortunately. But كمان also the inability to have outreach. So the idea of outreach is in a variety of forms in terms of preventive care and the use of the very widespread network of health units that we have in Egypt. But unfortunately, there wasn't a lot of trained manpower in it and a lot of تفعيل or using it really much more properly.
Yes, I just wanted to say that the particularly the paper on the healthcare response is extremely important, given the timing. And now we are working, of course, on making some version of it available in Arabic, because what it does is it's very rich empirically. And it, of course, it contextualizes the kind of response. It provides also a timeline of the policies and measures that were taken. So it reconstructs pretty much the specific response by the state and how it was made. And this is something that, by the way, is almost completely lacking. And it's done by people that have been active on this front for many years, who have been insiders both to like the civil society work in that particular area, as well as to the public sector healthcare system in Egypt. And that's why I think that it's pretty much a unique contribution, really, that should be taken directly into any kind of debate, especially that the pandemic has hit again in the context of some major redefinition and of the concept of healthcare, as well as the restructuring of the whole system with the pilot of like the تأمين الصحي الشامل, like universal healthcare that is being tried in a number of governorates. So this itself is very, very important, really.
In one of the papers produced by the project and that was written by Dina Makram-Ebeid and Hinda Ahmadzaki, the authors note an upward trend in cases of gender-based domestic violence. What did COVID-19 reveal about the capacity of the Egyptian state to combat this phenomena?
Yeah, I think what we saw in the paper on gender-based violence, the long history of attempts to work towards domestic violence. So to also map out a little bit what were the initiatives that existed before, how were they calculating domestic violence, were there increases, how are they calculating them now? Masalan, things like using things like the recordings that are being done, or the number of people who have been calling in to report cases of domestic violence, or the WhatsApp number as part of the counting, because one of the things that we see throughout the efforts that have been done before is, again, lack of data, which makes it very hard to make proper interventions. And the other thing is, okay, now you have lots of reports around domestic violence. What do you do about them, right? And how are people trained to handle some of these problems? So we see, masalan, again, there was not enough training. A lot of people would report cases of domestic violence and be told, let's get you together and so the shelters, instead of being places in which people actually run away from domestic violence, the approaches or the real preparation there wasn't quite efficient, if you want to put it, or wasn't a lot. There's also not so many shelters, and there isn't a lot of thinking of this propagation of the idea that a woman can run away and go to a shelter. It's almost unheard of in terms of the kind of message that you are sending to people. So what was the message that was being sent around in terms of the media and so on was also a little bit limited on that end, even if there were attempts to at least address it, as I said, through whatever, introducing a WhatsApp number so that women don't have to call on the phone if they are facing such issues, or helping women take cases to go to the police and file cases against their abusers and so on. This was also some of the interventions that were introduced, but again, there weren't enough preparations, not enough outreach. When you talk about the entire of Egypt, and we're talking about 9 or 11 shelters, is really, really, really little. So yeah, I guess that was the kind of what existed in terms of how we were prepared.
Thank you so much, Dina. As gender-based domestic violence has been increasing in the last 2 years, has the Egyptian government responded differently to this issue?
Definitely. I think that is one of the things that the paper said, that the pandemic seemed to be a very good entry point to talk about pre-existing social conditions or pre-existing problems that have been addressed by the government before, but as we said, with a bit of inefficiencies here and there. But the attempt to see, and especially with the extreme rise in cases of domestic-based violence, to see or to make the interventions much more efficient, and to think about masalan so some of the things that started happening were training to people who work in these shelters, proper training for how would you handle situations of people coming during, and specifically during Corona times, right? Because masalan, women would also have issues like other healthcare issues that aren't addressed, and you go to the shelter and there is Corona and everyone is afraid of telling people to go to hospitals. And so it's also weighing with women what are the kind of their own medical needs that are not COVID related, but that are impacted indirectly by COVID, and that need some form of counseling and help and thinking about it. But we see that there's definitely been much more introductions of training. The papers recommend that more of these trainings continue to happen. So this is one element, for instance.
I'd like to turn the discussion to the paper on social thinking in macroeconomic policies, which was co-authored by Amir Osman, Hania Shulqami, and Shahir Zaki. The authors note that the pandemic happened at the backdrop of declining government expenditures on social spending. So to what extent can we say that pre-existing government social policies have shaped the impact of the pandemic on vulnerable populations in the country?
One of the things we look at is how little there is in terms of spending on social protection, and how aslan it's also even put in terms of with other, even how it's calculated as an aggregate, as a number with other forms of government interventions that also include things like spending on infrastructure. So the actual spending on social protection, as we understand it, is quite little, and is not really fully formed in the sense of thinking about the different interventions, not just in terms of, and when we talk about social protection, we're not only talking about the number that will go into projects like Takaful Karama or things like that, but also to think about what is the investment on healthcare, what are our current investments on or what are budget allocations on to healthcare, which is again we're talking about numbers that are below averages worldwide. Amr would be definitely the one who's more equipped to talk about the numbers, but what we see is that our understanding of what constitutes social protection is, specifically in terms of budgeting, is quite problematic and needs to be broadened a little bit. Like at the eve of the pandemic, right? We had already seen a decrease in social spending, and here we're thinking social spending in terms of healthcare, education, and social protection from 7% to 5%. So this is complementing what Amr is saying. We're seeing things like poverty rates going up in very short periods of time, and quite significant. If you're going from 7% to 5%, that's quite a big decrease on social spending. Same as well applies to education, which went down from 4% to 2.3%, and so on. So we're this is the background. I'm talking here, the fiscal year 14 to fiscal year 19. This is where the papers put the numbers. And this is right at the eve of the onset of the pandemic. So we're very unprepared in the sense of, this is why we're saying that when we come to think of social protection, it comes as an afterthought, right? Because what has been happening structurally with the increased borrowing, with the increased neoliberalization and so on, and dependence on money coming from abroad, is these massive changes in spending, even if masalan healthcare remained almost the same. I think it was at 1.3%, which is still very, very little out of the whole GDP. But the general sense of public spending was significantly decreased.
So this was one of the things that were like brought to the attention of the readers in the very framing of the papers, and not only in the paper that directly tackled the question of social protection. Of course, it wasn't just the quantitative decline in the like whether social protection is dealt with as a percentage of total expenditure or of the GDP. Of course, Egypt like was and remains in a context of austerity, especially following the IMF deal in late 2016. And one of the very interesting things is that the Egyptian government has clearly prioritized what they call the maintenance of many of the gains that were achieved on the macroeconomic front despite the pandemic. And like this implied keeping the like expenditure under control, like as part of the commitment to the IMF deal, even though of course the program itself had expired. But then the IMF, of course, came back into the picture with the emergency funds and later on the standby agreement. So this is extremely important here, that the overall macroeconomic framework definitely limited the space, the fiscal space, as was used in the paper, that was available for policy or for like policy makers in order to devise the tools necessary to meet the challenges that were raised by the pandemic situation. So this is one thing, and that's why the conclusion of the social protection paper is, on the one hand, that the fiscal space has been quite limited, and I think that this was not wholly left to the decision makers who are well, quite committed to fiscal discipline, not very much receptive of the idea that this is like a rather a situation of emergency that may require the state to go out of its way in order to attend to the specific needs, especially that the pandemic hit almost immediately after the first round of some of the harshest austerity measures that were implemented in Egypt, and that resulted in an increase in the official poverty rate by almost 5% in less than 3 years. So the thing is that the other conclusion that is related to the first point is that social protection was an afterthought for many of the policymakers. So the priority was clearly to keep the budget deficit under control as much as they could, to keep generating the kind of macroeconomic indicators that were appealing to, I wouldn't say just investors, but specifically financial investors in Egypt's external debt. So many of these things resulted in the the social protection becoming second or third on the list. And again, this was quite this is very important for whichever kind of debate, not necessarily public debate, because this is not abundant in Egypt, but I mean like the kind of debate even within the circles of experts or academics or people that might be interested in specific questions of healthcare or social protection, that the overall policy and macroeconomic context are very important. And that's why the paper is really a very good contribution. By Shahir Zaki and Hania Shulami is a very good contribution in setting the agenda for a future debate even after the pandemic, because the focus is really on social protection in times of the pandemic rather than just the pandemic itself.
Thank you, Amr and Dina. This brings us to the end of our conversation in our second of 2 episodes on the Social Protection Egypt project. To our viewers, thank you for joining us, and see you next time.